Hello, my dear friends. Let's talk about the pneumonia a little bit, especially in the elderly, which is developing very easily when the patient catches cold and acute respiratory infection in the upper respiratory tract will happen. Usually, they will develop it because they don't care about themselves, first of all, and second, their immunity is not so well, circulation is not so well, they will stay at home. But sometimes the pneumonia will happen inside because of increased amount of the bacteria, and they are not cleaning usually, and it can cause the pneumonia. So the temperature cannot increase in the body. Will not have fever most of the time. Vice versa, it is, and decrease in the temperature. It will be about 35 degree, and it can develop uh, usually up to dyspnea, and they will have some like severe symptoms, and it needs like immediately uh, to be treated. You need antibiotics usually if it is not viral, and if it is candidates or something inside happen, using fluconazole or something else. But usually, if you diagnose the patient in the early stage, it will be so easy for like diagnosing it. First of all, uh, before anything, clinically, you will make a small diagnosis, and then you'll prescribe antibiotics to help the patient. And if it is severe, you need to prescribe glucocorticoids to inhalate. Inhalator is helping a lot, especially that uh, mm, treatment which is used in asthma. You can use like we have in Russia the drug Pulmicort, Birdual we can use, and salbutamol, salmeterol. Use it salbutamol if you have any attack during the pneumonia, can like open the respiratory. And if the treatment will not be effective, we need oxygenation and of course intravenous dexamethasone for a few days in order to reduce the inflammation inside of the lung. So the main thing for the pneumonia is early diagnosis and reduce the risk of the severity, because when the blood oxygenation will reduce, the risk of the IC syndrome and risk of the stroke and myocardial infarction, of course, will increase. And that stages, it's really dangerous because when there's intravascular disseminated syndrome, it's multiple organ dysfunction, and it can lead to die, to death. So the situation is completely complicated if you are not treating the patient in the early stage. And be aware of that when the patient have bronchitis. Of course, also you need to prescribe. Usually, it's when emergency care is going, the doctor is going to the patient at home and do not having anything, just listening to the patient. There's like wheezing or something, even sometimes without wheezing, when you see the pus coming out with the cough, you have to prescribe some antibiotics to reduce the risks of the pneumonia and to let the patient to have some recovery. And then you can send the patient to the x-ray or CT scan or something to confirm your diagnosis. And blood test is also important and coagulogram, especially if the D-dimer increased in the patient with the COVID, it's also dangerous, and you have to to know about the coagulation state of the patient when there is the severe stage. That's why the blood analysis is also so important in such patients. So, guys, uh, if you wanna like treat the patient, do it in the early stage, and just clinically, when you see any pause or anything which is the patient is telling you about it, just you have to immediately act, and then all will be fine. I think in the early stages of the COVID, even when the patient having some risk factors like obesity, like cardiovascular disease, the previous stroke, or any kind of other like arteriosclerosis, any kind of the other risk is thrombosis, and varicose veins, all of these steps are mostly they have a risk factor for developing severity of the this respiratory diseases, and it can lead to some complications and end up with something bad. So be aware of that. Also, most of the patients which are smokers, especially chain smokers, the situation will be more worse because most of them they have chronic bronchitis, and chronic bronchitis, it can lead usually and so often to pneumonia, and they're not having well lung, so the disease can develop very fastly, and it can be really fatal for the patient. Okay, I hope it was useful for you, this video. Bye bye.